We typically describe cancers based upon the tissue from which they originate: breast cancer, lung cancer, brain cancer. So what's a sarcoma? Well, a sarcoma is a cancer that originates in what we call connective tissue, the tissue that joins organs together. The Alliance for Cancer Gene Therapy is funding a project in my laboratory that is focused on developing CAR T cells, or chimeric antigen receptors, for the treatment of solid tumors, in particular osteosarcoma in children and young adults. This is the most common sarcoma of bone. The type of science that my laboratory is known for is early first-in-human, first-in-child clinical trials, where we're kind of taking a chance, but we do it in a patient population where they've typically no longer have any option with standard therapy. That kind of funding is difficult to get, except through entities like ACGT, which are really focused on translation. The other piece of this is that funding is very important in order to study the patients that we treat. Because when we administer the therapy in the clinic, that's not when our work in the laboratory is over. In many ways, it's when our work begins, because we want to learn from each patient and find out if they responded, why did they respond? If they didn't respond, why didn't they? How can we distinguish the patients who benefited from those who didn't? And again, that kind of funding is difficult to come by through the traditional NIH funding mechanisms. We are at the final phases of our laboratory testing with our what I'll call new and improved GD2 CAR. And we plan to begin these studies in the first half of 2019. The ACGT grant has allowed us to take these CAR T cells targeting GD2 and make the next generation version that we now believe has been optimized. And based upon our studies in the mice, it looks as if they're going to show promise in the clinic. And as an immunotherapist, there is no question that we have entered what is a completely new era for the treatment of cancer. There are many other immunotherapies that today are showing incredible promise across multiple different types of cancers. More than 25 cancers now have an FDA-approved immunotherapy as part of their standard treatment regimen. We used to think of the treatment for cancer as being surgery and radiation and chemo, and now you need to say surgery, radiation, chemotherapy, and immunotherapy. But I do want to take a minute and note again the challenges of childhood cancer, because there the market size is small, and so the private sector investment is typically less. There is an absolutely essential need for funding from nonprofit entities like Swim Across America, Wendy's Walk, and ACGT for the late preclinical studies, the early translational studies, the IND-enabling studies. You'll hear them called all these types of descriptors. And it basically means, what does it take to get it into the clinic and to study those patients who receive the first iteration of these therapies? This is still a new area, and the cost of goods is very high, and much of what it takes to make these cells is in limiting supply. I am absolutely of the belief that the cost of this therapy will go down as more competition comes into the space. We will likely find a way to be able to give off-the-shelf CAR T cells. And so I think there are many technological advances that will occur and that will make CAR T cells more available to people who need them.